Good evening, everyone. We're about to begin. Let me just bring up my face here a little bit. All right, so we're about to begin here shortly. I'm going to invite you to just follow the link right here that gives you the handout, so you can download the handout that goes with this lecture. That way you'll be able to participate with us. So just click on that link and it will take you to the handout for the class so we can participate together. We're about to begin. All right, so welcome everyone. Let me just make sure that my Teams people are also able to hear and see me. So, good evening, everyone. Welcome. And the let me just make sure I'm out of the way here. All right, that's better, I think. Yeah. Good. That looks good. Welcome, everyone. Welcome, welcome, welcome. And I hope that everyone is hearing me fine. If you're hearing me, please indicate by clicking in the commenting in the chat, or just open your mics in Teams and let me know that you're hearing me fine. I wait for some. I didn't hear you, Lauren. I think you were trying to say something.
Yes, I'm right here. I'm listening to you, sir.
Good, good. Welcome, welcome, welcome. All right. All right, almost there. I have a few more people there. Stacy is not able to connect on Teams. Um, I'm trying to see if we can help her. Help Sonia. Help Stacy, rather. All right, so I think we're just gonna have to begin there with who we have, and when the rest of persons join us, we will take it from there. I mean, Stacy, you might not be able to comment verbally, but if you just watch us on YouTube, you'll be fine. You'll be fine. And that goes for anyone else who might not be able to catch us um, on Teams. Alrighty. So tonight we're going to be discussing the topic 7 keys to getting and staying well. 7 keys to getting and staying well. All right. Sorry about that little delay. Let's begin. Alrighty. So as I indicated before, it's the 7 keys to getting and staying well. And if you have not yet downloaded the handout, I'm going to invite you to do so now. Please download the handout. We are about to begin now, so I don't want anyone to be left behind. And we have to wrap up by, I tell you, in another 48 minutes, we have to wrap up. So it's about an hour presentation, so I'm going to have to go pretty quickly. All right, first off, the handouts. Did you all already download the handout? You can find it by just going into the chat section and clicking on the link in the chat section to download the handout. So please go there so you can download the handout so you can follow along, and if we lose you somehow, we'll be able to catch up. So the topic for today is understanding a very simple but important concept, and that is sick care versus healthcare. And when we talk about the healthcare system, we're talking about the system that is responsible for addressing the mainstream way of addressing our health concerns. And this is by way of our doctor's offices or our clinics or our hospitals. And so this is what we call, generally speaking, the healthcare system. However, there is a downside to this system, and it's not necessarily my trying to nitpick on the system. It's just to be able to understand what it offers and what it does not offer, and so people can make choices that make sense for themselves. So what the system offers is that it offers persons with the ability to go to get a health concern dealt with. It might be that they have some kind of a disease, or they've had an accident or some fall or some trauma, and as a result of this, they are not able to either function or survive, or they're suffering. And so they go to the healthcare system so that they can get some assistance with returning them back to some decent function. And so that's what the system is geared to do. It is designed to address these issues. Now, when we look at the notion of who is the focus of this system, it's obvious that the focus of this system are people who are sick. It is sick persons that are the focus, and so as a result, they because it's caring for the sick, I'm going to from this point forward refer to the mainstream medical system as the sick care system because that's who they're caring for, and it's not a derogatory meaning at all. However, true healthcare is a little bit different. True healthcare requires us to look at not just people who are sick, but also people who want to prevent themselves from getting sick. And so, because of that, there is a difference in the two systems. The primary difference is this: sick care is reactive. Something has to go wrong first before you can intervene at some level in the current mainstream model. Whereas true healthcare is proactive, meaning that there are things that are done or need to be done so as to prevent illness or sickness from developing in the first place. Now, many people would say, but the current system of healthcare does have components that are proactive. And if you understand by proactive, I mean preventative, then the answer is no. The current healthcare system is not preventative in any way. Even if you talk about lab work, blood tests, or MRIs, or X-rays, or mammograms, or whatever diagnostic tests you want to run on somebody, it is almost always run with a diagnostic code, meaning that you suspect the person as having a particular disease. And so you want to run the test to rule out this disease. And so it takes it from being preventative to being a way of determining if a disease is present. And that's by way of the diagnosis. Now, the good thing about those approaches is that they are early detection approaches, meaning that you're trying to identify a problem at the very earliest stage that the problem is there. That is way better than not knowing, but it is not preventative because the person would already have the problem. You just want to detect it earlier. So early detection is different from prevention, and that's something that we need to understand. Early detection is not prevention. But in the current model that we have as far as the healthcare system is concerned, we have way too many sick people for the beds that we have. Now, there are two ways of addressing the problem of not enough beds. The first way is to try to get more beds. And there are problems with that approach, because with that approach, what ends up happening is, how many beds can you possibly get for the space that you have to work? The better approach would be, rather than focusing on the beds, you're focusing on the patients. Try to reduce the number of sick people that are coming to your hospitals. That is the best way to prevent your problem of not enough beds. Reduce the number of sick people. And this is what I would encourage. And so you can't simply be trying to solve a problem that's lifestyle related, which the majority of diseases that we have that people go to hospitals for are lifestyle diseases. And we can't solve a lifestyle disease with drugs and surgery. You have to solve a lifestyle disease with a lifestyle solution. A change in how we live so as to prevent ourselves from breaking down or getting sick. In order for us to be able to change our mindset or our behavior rather, we all know that there are certain ways that if we live a particular way, we are more likely to get sick. And so if we want to avoid getting sick, we need to live a different way. And so what we've recognized is, if you're trying to change behavior, changing behavior by itself is very difficult. It is far easier to change the way you view things, because it's your determines how you act. And so we want to be able to modify the way that our worldview exists, or how we think of the world around us. And once we are able to do that successfully, then we have a better chance of overcoming the challenges that we face as it relates to illness or illnesses. I'm sorry for the ones watching on Teams. My screen was flipped the other way, so I've now rectified that. So there we have it. You should be good to go now. So, especially since we're going to be doing a lot of reading now on the screen. And I want you to get it. So, we have to adjust our thinking. How do we adjust our thinking? How do we change our mindset? And what mindset do we currently have? If you're traveling somewhere and you're going to use a map is useless to you unless you know one thing first. A map is useless to you unless you know one thing first. So what is that thing that we must know? We must know where we currently are on the map. Because if we do not know where we are, we cannot navigate to where we're going. If you don't know where you're situated right now, how are you going to know whether you need to take a left or a right, forward or backward to get to your destination? So we have to know where we are on this health spectrum, if you will, in order for us to make wise choices and navigate properly. So if we want to adjust the way we're thinking, we need to know how we are currently thinking. And for the majority of us, the current way of thinking is based on what we call the illness model or the sick care model. And that way of thinking is brought to us by the pharmaceutical industry. Nobody should be surprised about that. Because when you look at a TV commercial that has a drug on TV, they are trying to tell you that if you have this skin rash, take such and such because it can help. This is how they program us into thinking. So we start to connect. If I have a problem, I need to think of what drug I need to take to resolve that problem. But drugs have a downside, and the downside of drugs is that in order for them to work, they have to override the way the body works. They have to override normal human physiology in order for it to do anything. But the problem with overriding our physiology is that it can put us in a disease state or an illness state and thereby making things way more difficult for us. Way more difficult. Now, here are the ways that that system tries to tell us to think. The first way of thinking in accordance to the illness model is we're taught to want to simply feel better. So if we have a pain or some discomfort or some issue, the first question we ask is, doctor, what can I take in order to feel better? You have a headache, what can you take to ease the pain? What can you take to relieve the headache? What can I take to feel better? That is all we care about. We need to change from that limited mindset to a more advanced mindset that has our best interests at heart. And so how does the wellness care way of thinking say or dictate? It says to us, rather than asking what I can take to feel better, you ask a slightly different question. The question becomes, what can I do in order to get better? Because getting better is far more important than simply feeling better. Getting better means you're recovering from the illness or the ailment. Feeling better does not necessarily mean you're recovering at all. The next thing is getting well.
Excuse me, doctor. My board is upside down because getting better it's still upside down. All my writing and everything is upside down on my board here.
Um, is it so, Mary? Is that so for you as well? Mary, can you let me know whether or not your screen is spun around? All right, hold on, Lorna. I'm gonna do something here, and you tell me if this fixes it. Does that fix it?
Yes, sir. Thank you.
All right. And so let us continue, therefore. Let us continue. According to the wellness way of thinking, we want to get better. Now, according to the illness care, the other thing is, the other mindset that we have to change is concerning wellness. And I don't know if you've ever gone to the hospital and you've gone to the doctor or gone in with a balloon or a card or a teddy bear or whatever to bring to the person who is in the hospital, and on it you have written the words that are known all too well: get well soon. Because for us, the goal is simply just wanting to get well. But what's the purpose or the point of getting well? Getting well involves just a wish, a hope, a dream. There's nothing that you're asking the person to do. There's nothing that the person is motivated to do. You're just hoping that wellness will fall into their laps. And the problem with that is that wellness is not a destination concept. Wellness is a journey concept. So it is the journey that's more important, not the destination. And so we want persons to start to understand, when you are trying to be well, you can't simply hope to just get there. The better way of thinking is, rather than saying, how can I get well, you ask, what do I need to do in order to stay well? Because if you think about staying well, automatically you're thinking about, one, that means I'm doing something to get well, and two, I have to continue to do it in order to remain in that state. So we want persons to understand, getting well is a wish. Wishes may or may not come true. What we want persons to do is to change their mindset from wanting to simply get well to what do they need to do ongoingly in order to stay well. I hope that makes sense. And the gold standard that we use currently in terms of how well we're doing as far as our health is how long we live. We hear people say this all the time. Jamaica is a healthier population because we have more old people now than we did before. That's not necessarily true. There's several things that can kill somebody. It's not necessarily ill health that kills everybody. So staying alive might or might not have anything to do with your health. What we encourage persons to do, or how we encourage persons to think instead, is to think, rather than staying alive, how about trying to feel alive? Because the feeling alive means that your quality of life is good. And the quality of life is way more valuable than simply being alive. Now, being alive might be beneficial for your family members or those who love you, who don't want to see you go. But for the person, what's the point of living if you're suffering? You know what I mean? Who wants to suffer through life? What we want to do is we want to live a good, high quality life that enables us to enjoy that life. So feeling alive is more important. So I'm going to point your attention back to um, the table here, so that you can see that feel, get, stay becomes get, stay, feel. Feel, get, stay becomes get, stay, feel. It's a subtle change in how we think that shifts us from one mindset to the next. And sometimes people think that in order for you to make a big change in your life, you have to make a big change in your thought. But the reality is, a small change in how we think can change the direction of our entire lives. And that's what this is about. And that's what this is about. Hi, Miss Beverly. How are you? DeAndre, I see that you're here. Shanique, welcome. Maria, Felicia, good evening to you all. All right, so let's continue with this because it's going to get spicy now, because now we're going to talk about some things that I think a lot of people end up coming to see me or other chiropractors about, and that is pain. But many people have a bad understanding of pain, and so they make bad choices. So when it comes to pain, good. When it comes to pain, we have a bad understanding, and because of that bad understanding, we make bad decisions. And so I'm going to try to clarify pain a little bit for you so that you understand, because many people think that pain tells you when something is wrong, and that's not entirely true. Pain may tell you that some things are wrong, but there are many things that could go wrong where there's no pain associated with it. So how will you know that something is wrong? So the truth about pain is that yes, it can be good or bad, but there are limitations to pain. Yes, it can alert us that something has changed and needs our attention, but it doesn't always alert us. And that is the shortcoming of pain. That is the problem of pain. It doesn't always tell us when something is wrong, because you can't trust it to always respond, because there are some things that don't have pain associated with it. And I'll give you a good example. Cancer. If somebody has cancer, especially like breast cancer and so on, breast cancer doesn't have any pain at the beginning, you know. What they usually find is not a painful mass in their breast. They usually find a painless lump. Something that seems benign, like a little bump in their breast, but when they press it, it doesn't hurt. That's how pain reacts with cancer, or cancer deals with the whole issue of pain. So, and that's why we can't simply wait for pain to tell us. We have to find other means of knowing if we're doing well. Feeling healthy or feeling good does not mean you're healthy. Feeling good does not mean you're healthy. And that's so important for you to recognize. In order for you to be healthy, all the body functions have to be working the way it's supposed to be working. So we need to start trusting the way our bodies work and not simply how our bodies feel. Trust the function and not the feeling. As we continue, the different systems of the body as are listed here. If you notice, you have the immune system here, digestive system, cardiovascular system, respiratory system, reproductive system, endocrine system, integumentary system, excretory system, nervous system, musculoskeletal system. These are different systems of the body. And these systems all must work together for the body to be healthy. If there's any one system that's not working properly, our bodies will not manifest good health. And so we have to make sure that our bodies are working appropriately in order for us to be healthy. So, of these systems, I'm going to point out something very important because there's one system up here that's a little bit different from the rest. What makes this system different is how it controls and regulates all the other systems of our body. Every system communicates with at least one other system. But there is one system that not just communicates with the other systems, but governs their function. And that system is the nervous system. The nervous system. So when you look at the nervous system, it comprises the brain and spinal cord, which makes up the central nervous system. The brain and spinal cord makes up the central nervous system. And the nerves that come off on the end, these nerves here, those yellow nerves, are the nerves that go from the spine to the different organs and systems of our body. So if there's a problem, for example, in this part of our spine, can you see how it may impact the function of our heart and our lungs? And this is so true. This is so true. Now, as I indicated, the nervous system is the master control system of the body, and a spinal misalignment has a special name in chiropractic, and we call that name vertebral subluxation. A vertebral subluxation is a misalignment in the spine, and these misalignments do impact how our bodies work. They may impact how the nerves carry signal, and the nerves control our functions, so it changes how our functions go on. And the last thing is, if you have a vertebral subluxation, it will impact and impair our nervous system function. Now in this diagram, it kind of tries to show you and highlight how this works. Now if you look at this third bone down from the top, the third bone right here, the third bone down from the top, you will notice that it is not aligned with the other bones around it. It is shifted backwards. And these bones are more forward or backward, depends on whether you're reading right to left. Now, there's an opening in the back which allows the nerves to travel. These yellow things and this red one are the nerves. They travel through these openings in the back. So if this bone gets shifted out of place, guess what happens to the opening? It closes off. Guess what happens to the nerve that passes in that opening? It comprises that nerve. We have a name for that. And many people are already familiar with that name. What's that name? We call that a pinched nerve. You may have heard of it. Now, when the bone gets shifted out of place, the cartilage between the bones may get shifted as well. We call the cartilage the disc, and the special term we call that is a slipped disc. So you may have heard of a pinched nerve and a slipped disc and not know where it came from. But this is where it came from. The pinched nerve is the compression of the nerve, as it's passing through the spine, and the slip disc represents the disc that is shifting out of place. Now, because of that movement, the disc may press on the nerve or the bone may press on the nerve. Either way, the nerve is compromised and will not function the way it's supposed to. So lifestyle stresses occur, and this is what causes subluxations to happen. Lifestyle stresses are the real cause of these maladies that affect our bodies. But there are three types of stressors. One is physical, like a car accident or a fall. One is biochemical, like chemicals that we put on our skin, like lotion or perfumes or what have you, or things that we put into our mouth, like the water we drink or sodas or what have you, as well as psychological, the things that we are exposed to. Psychologically, for example, if you're in a stressful relationship, that can offer psychological stress for you. But any of these three can impact the way our bodies work. And so we need to make sure our bodies are healthy. Very important. Oh, by the way, this last point is that the healthier our nervous systems are, the better we're able to adapt to our environmental stresses. And this adapt, I'm going to do something with this here to kind of explain why we get sick. And so when we look at the body has what we call a general adaptive potential. A general adaptive potential. And this general adaptive potential is our ability to adapt to our environment. But our ability to adapt is determined by the width of our general adaptive potential, or gap. So I'm going to show you what I mean by the general adaptive potential. Every gap has a lower limit as well as an upper limit, where the space between the two areas represents the gap. That is the space. Now, the wider the gap is, the healthier you are. What makes the gap wider? The upper limit going further up. That's what makes the gap wider. What makes the gap narrower? The upper limit going down. Because the lower limit can't move. It's at the lowest possible end. So the only way to increase the gap is by going up on our upper limit or coming down on that upper limit. What are some of the things that happens when our upper limit is increased? We experience vitality. When that upper limit is increased, we experience vitality, true wellness. When it is decreased, we go down towards death. Sorry about that. Now, for our upper limit to go down, it's very easy because all the stressors in our environment focus on bringing down our upper limit. And this is our external stressors, our ES. It pushes down on our upper limit, and the only thing that we have to counteract that is our internal resistance pushing back up. If our internal resistance is strong when compared to the stressor, our gap can actually stay wide and sometimes even widen still. But if our external stressors become stronger than our resistance, then that upper limit will fall down and go down toward death. So it's important that we understand this. If all our life experiences occur within the boundaries of our gap, we don't break down, we don't get sick, we don't falter, nothing happens. We stay healthy. But once our upper limit falls, then we may become vulnerable. And in this case, our weaknesses might be where you see the red line here and here, the crossing here, that's where we get sick. And for some families, you might be predisposed to diabetes, or you might be predisposed to heart disease. And so when your lifestyle is of such where you have too much stressors opposing your health, then the place where you're likely to break down first will be the place where you're weakest. And so this is important for us to be aware of. Alright? So I hope that helps you to understand our nervous system function. Then by extension, it must also widen our gap. However, chiropractic by itself doesn't do that. You can't live a poor lifestyle and then throw chiropractic on top and expect to be healthy. When we talk about a holistic approach to health, we're talking about all the dimensions of health coming together to make you healthy. So this is very important. So we invest in technology to help us to identify wherever and whenever there's a problem in the spine. We have two devices in particular that we use to measure spinal function. This first one is called our surface EMG, our rolling thermal scanner. This is what we roll up the spine to measure the temperature of the skin. That gives us an idea as to how healthy the person's spine is. And this one over here measures the muscle tension, the tone of the muscles in the spine, to let us know how those muscle nerves are doing. We want to know as much as possible so that we can make wise choices. Now, this particular study is one where a person was asked to do an experiment to see how chiropractic care can impact the brain function. Because if chiropractic is really something that can change the way the nervous system works, then it must also change the way the brain works. Because everything that happens to the nervous system will be recorded in the brain for processing and response. Hopefully, appropriate response. So as we are looking at it, one second. As we recognize, there are different color lights that we see on the two brain images. The first one on the left is before an adjustment. Second one is after the adjustment. And the person was asked to wiggle her left ankle, and then a picture of the brain was taken. And you see, before the adjustment, you see all the areas of lighted activities. The lights represent the active cells in the brain. The more active cells there are in the brain, is the more the brain is working to do whatever it needs to do. So in order to improve that, we have to try to see if we can reduce the number of lights that are present in the brain. And we have identified that we can do that simply by doing a chiropractic adjustment. Because she received an adjustment in her neck, the scan repeated, and only these areas, which are the appropriate areas, were actually lighting up. Which means that she was operating better. She was operating better. And so chiropractic does improve the way the brain will see the body, and in turn how the body will work. So when people ask you in the future, what kind of doctor is a chiropractor? Please do not say to them that a chiropractor is a bone doctor, because it's not so much the bones that we work on, but the nervous system. That's what we work on. Now, just to point out that I am a specialist in the field of chiropractic, meaning that I have specialized training. My training and my qualifications enable me to call myself professionally as a chiropractic neurologist. A chiropractic neurologist is a special kind of neurologist. It's not like a medical neurologist that oftentimes their main tool will be drugs and surgeries. Um, for us, our main tools are still exercises of some type, brain-based therapies, and our hands. So we don't necessarily operate on persons in order to get them well. Now, let's watch and see what a chiropractic neurologist versus a chiropractor entails. Chiropractors realign the spine. That's all. That's what our training involves. Whereas a chiropractic neurologist retrains the brain, and we do that, as I indicated, by way of exercises and so on. We have. Sorry. We have different things that we have seen and worked on as a chiropractic neurologist here in our office. Some of them are listed here on the screen behind me. So I encourage you to look at it and see if there's anything that applies to anybody that you know. Maybe we can help them. Our vision in Gardner Chiropractic is threefold. One is to identify subluxations wherever and whenever they happen. Two, to provide a program of chiropractic care to help persons to recover from their illness. And when I say a program, we don't just normally recommend one treatment. We usually recommend a program of care. Usually a phase of care is about 12 sessions. And the majority of people will need 12 sessions to start. However, the frequency of those visits will depend on how healthy they are. So for some persons, we'll see them twice a week. Other people might see them once a week, and so on. At the start, the majority of people in my observation seem to fall into the twice a week category, and we don't almost ever do 3 times a week sessions. We usually just stick to the twice a week. And we also educate our community, and we educate our community using methods like these. This forum that we have here is a way that we do that. Now, who's responsible for your health in the last note here? The key to success in getting and staying well is for us to take responsibility for our health and well-being. It is our responsibility to be healthy. Nobody else's. This is our responsibility, and we need to make sure we take it seriously. In my YouTube channel, you will find several videos that are testimonial videos. You're welcome to watch them so you can have a sense of what it is that we do and how it works. And for those of us, if you are not currently a patient and you want to get an appointment made to come and see me having watched this presentation, then you will receive a 40% discount if your name appears in the chat section and you simply go to appointments at gcnjamaica.com. That is appointments at gcnjamaica.com. So I've sent it in the chat. So let's see how you do with that. Um, so for our patients who are existing patients, you will get a couple things. You'll get the 20% discount off your update exam just for being a part of this class. So make sure that you send the email, let them know that you're in the class so that you can get this discount. If you refer somebody to the office, you get a 20% discount off one treatment. And you know what? That person also gets 20% discount off their examination. So because I teach better than you will teach, I'm giving a 40% discount if you listen to me explain chiropractic to you. You will give, if you explain to somebody else, they will get 20% just by you explaining it to them. So they still get a benefit even if they're not on this tonight. And there's a phase of care discount, which is after you finish the first set of treatments, if more treatments are required, then you'll get a 10% discount off the very next phase of care. And because of that, all of those things, the total discount that the existing patient gets is actually considerably more than the new patient, which is right because, existing patients are more important. They have demonstrated and you have demonstrated your love for us. So that is that. You can find us online at gcnjamaica.com. That's our website. Or on Facebook at GCN Jamaica. But we also have a radio talk show on RGR every Tuesday evening at 8 o'clock Jamaica time. And that is facebook.com/Back to Health Talk Show. So Back to Health Talk Show. Or if you just want to go to our YouTube channel, well, you're already here. So you should know how to do that. So thank you so much for participating. And we're about to lose our connection to Teams. So if you have any quick questions that you wanted to ask, you're welcome to ask it now before I lose connection. But otherwise, have a great night, everyone. Thank you so much for joining us. I hope you learned something. I hope it was meaningful. But yeah, any questions? We have 1 minute or less than a minute. For Dennis, your question about a good dose of omega-3. You take 4 grams a day of DHA and EPA. I'm not sure what number to tell you is a good number. But what I can say is that if there is a specific issue, you will take more. If you don't really have an issue and you're just wanting to maintain yourself, you will take less. And a good source of DHA to EPA ratio for brain function is not even just omega-3 fatty acids, but not fish oils rather, but krill oil, Krill, krill oil. So you can go to the health food store and ask them for krill oil, and that actually is a very good source of omega-3s, especially for brain function. I hope that helps. All right, so you're welcome. Thank you, Stacey, and I hope you appreciated it. Hope you enjoyed it. And to everyone who is with us online, thank you so much for joining us tonight. I wish I could stay with you forever, but blessings to you, Lorna, Mary. Thank you for joining us.
Thank you.
You're very welcome, my dear. You're very welcome. So I wish for you all the very best. And yeah,
Quick question.
yes,
When will we having another session and class and the online?
like this.
Yes.
Every third Thursday of the month we have it. Every third Thursday we have this class.
Okay.
So the next one is March 18th.
Is
Sorry, April 18th. The next class is April 18th. Sorry. All right. Have a blessed day, everyone. Have a wonderful night. And be safe if you're not yet home. Take your time and get home safely.
You too, sir. Have a very blessed night.
Thank you for joining us. Bye bye now.